Hello, welcome to Pediatrics. Welcome to Baby Hal. This is a mannequin, a newborn mannequin that we will be using for a couple of our simulations. The baby is remote, which means that he does not need to be hooked up to a cord. He may at times be hooked up to a cord if the battery runs out in the middle of a sim, but we try very hard to maintain the ability to pick him up, move him around, hold him, reposition him. So we try not to have him plugged in. You do need to be aware that he has IV tubing in one of his arms that will, the down drain, this down drain is typically connected to a bucket that is down in one of the bassinet drawers. So that is something that you have to be aware of so that you don't pull that cord out. Otherwise, he's very movable, he's very holdable. So we'll undress him a little bit so that you can see him. Take this little blanket off. We do have some clothing for him. We've got some t-shirts. I'm going to start with a little head-to-toe explanation of him. We've got a hat. Baby Hal does have a fontanelle that is an anterior fontanelle, not a posterior fontanelle. And this fontanelle does pulsate with his heart rate if you just touch it lightly. You can feel it. We cannot change the fullness of it or the amount of tension. So this is the way it feels under all conditions. For the breath sounds, they are best heard in the upper anterior lobes up here. They are louder in the left. Be aware that these mannequins are small, so all this machinery has to fit inside these small bodies. So because of that, you don't necessarily hear sounds where they should anatomically be on a real baby. So his breath sounds are louder on the left. Just assume that his breath sounds are equal. You won't be able to hear them if you're too far lateral on the chest wall. So if you're listening more in an axillary area, here or here, you won't be able to hear them at all. This is the best place to hear breath sounds, is upper anterior. You won't be able to hear them at all in the back, but you are able to do your assessment front and back. So please do that. When you're listening to the back, you're doing those types of things, ask what you're hearing, and we will be happy to tell you. Also, if you're not able to hear, you're trying to listen for heart tones and it's difficult for you to hear, just ask us to turn up the sounds, down the sounds. We can turn up the heart tones and turn down the breath sounds so that you can better hear the heart tones if that will be easier for you. Assume that that the sounds that you hear in the lungs are in all lung fields. If you hear abnormal respiratory sounds from the baby, determine if they're coordinated with inspiration or expiration, and that will help you with your overall assessment of what type of sounds you are hearing. The heart sounds are quite mechanical sounding. Don't mistake them as being a murmur. When we use Baby Hal, we will not be using it for cardiac simulations, so we will not be programming a murmur. For pulses, he only has brachial pulses. Let's see if we can uncover an arm. He has a little pad right in here, and that's where you would feel brachial pulses. He's got that bilaterally, but he does not have femoral pulses, pedal pulses, pulses anywhere else other than his anterior fontanelle, and you can also feel pulses in his umbilical cord when the umbilical cord is attached. We have one simulation where he is a newborn, he will have an umbilical cord. There's another simulation where he is a 5-month-old baby, then he will not have the umbilical cord attached. The bowel sounds are not really audible on this mannequin, even at the highest setting, the highest volume. So as you do your exam and you are listening for bowel sounds with your stethoscope, do the motions and then just ask us what you are hearing. For a catheterization, urinary catheterization, you are able to catheterize this baby. Just straighten the penis the same way you would on any mannequin, and you will be able to catheterize. You will be able to advance the catheter. This baby will show circumoral cyanosis, and we will show that to you. He does not have acrocyanosis, so you will have to ask about that, if this baby has acrocyanosis and to what degree. It does not have cap fill time, so you will need to ask about the cap fill time. It does not have skin temperature. None of our mannequins have skin temperature. You will have to ask about that. It does move. It's articulated. And we can show some movement in this mannequin. Our first setting is active. See that you can see that he moves his arms. The next movement is jitteriness. So as you can see, his arms will make a jittery movement. The movement is all in his arms. He doesn't have movement in his legs. The next movement is seizure. We just have this repetitive movement in the arm. In both arms. Our last movement is
reduced,
reduced. So with reduced movement, we just have occasional arm movement. And then our last setting is limp. And the baby does not move any of his extremities when we have it on this setting. We may have it on this setting to help save the battery, so that we're not running out of battery in the middle of the simulation. Don't assume that there's something terribly wrong. You just need to look for chest movement, and the chest movement will continue. There's nothing wrong with the baby if he's not moving necessarily. You can always ask. So you can see the chest movement there with the tangential lighting. Baby Hal is also capable of making several sounds. First one is crying. The next one is stridor. The next one is soft grunting. And the last one is strong grunting. You will need to look at the chest movement when those sounds are being made and see if the sounds are being made with inspiration or expiration. That is what's going to help you assess what type of sound the baby is making. And that is our baby Hal.